Okay, so give us the particulars. The deal is done. Biomedical research and the state of Louisiana have reached an agreement for biomedical research to continue operating their sort of management deal.
Yep, the governor's in Cuba, but they did release a brief statement saying they've reached an agreement. It came from Matthew Block, his executive counsel. Biomed will provide $37 million in additional payments to LSU doctors for their services at the hospitals, and the hospital operator will also pay nearly $7 million that LSU says is owed in unpaid bills.
So joining us to discuss this deal, the particulars, what they know, what we might not know, is State Representative Cedric Glover, and on the phone is State Senator Greg Tarver. Mr. Greg, how are you this morning? We've already said hi to Mr. Cedric.
Good morning to each one of you all. Good morning, Cedric.
Good morning to you. Let me ask you first, Senator Tarver. Is this a good deal for Shreveport and University Health?
Well, I don't know if it's a good deal, but I know it's a deal that is not completed yet. Everybody talking about signing a contract, but I'd like to see the first signature on the contract. They got 3 or 4 people that need to sign, the president of the university and other people, and I've heard that they did not like what is in the contract. So I really don't know if it's going to be a contract or not. I'm going to wait and see.
I was just, my first question for you, Mr. Gregg, was going to be, you had 1 or 2 unflattering things to say about Biomedical Research Foundation. Given the fact that the deal is done, is there anything that could be in that deal that would make you happy about the deal itself?
Well, let me say this to you. I've been in this political game a long time, and politics is compromised. And I'm willing to work with anyone that is willing to deliver good services, good healthcare services to the people, regardless, whoever it may be.
Cedric Glover is joining us this morning, too, and he has been, you guys have been on the opposite end. Cedric, what do you know about the deal? What does it do for Shreveport and our community?
Well, let me first of all say good morning to Senator Tarver as well, and I'm delighted to be here with both of you all. I think what we have here is some actual real movement on the part of the governor and the administration and the folks from LSU, a realization that there are a lot of folks here who are just simply not willing to accept a reversal in this situation, and they were committed to staying at the table until something got done. I think what made that possible, however, is the outstanding work that has been done by the university health employees over the last 3 years. Some folks who had their lives turned upside down when this thing started in October of 2013, but who put their shoulders to the wheel, have made the best of it, and have actually made the quality of care there better and given us greater value and a higher level of service both here in Shreveport as well as in Monroe.
Mr. Gregg, you and I had talked a couple of times that we've had you on, and we sort of likened this back and forth between the state and Biomedical Research Foundation as sort of a poker game. If that analogy is still legit, are both sides winners, both sides losers, one winner, one loser? What do you think? What's your assessment?
Well, only the people can be the losers in this situation. If you go to University Health, and if you're a patient of University Health, if like I'm a patient, and I don't know too many elected officials are patients of University Health. I think the University Health got a good deal. I think the LSU Medical School, I hope and pray that they stop arguing and fighting each other and move forward. Regardless, if you don't like the deal, it's a deal, and you got to move forward with it.
What about you two gentlemen, Mr. Glover? Are y'all kind of coming closer to how you feel about this deal?
Well, from my perspective, here's the thing that I thought was very crucial to getting this done, and it's something that the folks from the Biomedical Research Foundation, or BRF, have been asking for since the very beginning, and that is to be able to resolve disputes between themselves and the medical school and LSU through binding arbitration. That is something that the state, the governor, the LSU folks, the med school folks would never be willing to accept. It was very similar to their premature effort last year in filing lawsuit to end the contract. And they went to court, and the judge told them, guys, you haven't put forth a good faith effort to try and resolve and address your conflicts. And so he threw it out. And so now what you have is a means and a mechanism by which the issues, the conflicts, the problems that may develop in all relationships, and obviously particularly in this one, now have a venue, a form by which they can be effectively addressed, resolved, and put behind them, and it allows things to go forward.
Cedric, you had made reference more than once that you believe there is a faction of South Louisiana politicians who wanted our medical school. You've said they're trying to choke off Shreveport in any number of ways. Do you believe that this morning that group is a failure? Do you think they were working behind the scenes to keep this agreement from being reached?
I know that the Baton Rouge Area Foundation released in December of 2015 a 150-plus page report that says the thing that they need to do is to create a healthcare district in Baton Rouge along Perkins Road, O'Neill Lane, and that the real key to making that work is the development of a full 4-year medical school that allows them to be able to have a comprehensive academic medical center in Baton Rouge. That is something that they are working towards. It is something they intend to have, and I have no expectation that the state is in a position to have a medical school in New Orleans, Baton Rouge, and Shreveport.
Senator Tarver, you have told us all along that the med school in Shreveport has never been in jeopardy and never will be. Do you still feel that way?
Well, yes, I do feel that way. Been dealing with the medical school since I've been in the political life in the Senate for 26 years. The medical school is solid in concrete. It's going to move forward. The only thing jeopardize it is the people who fight LSU Med School at this particular time. And we have a lot of people in Shreveport that are fighting LSU Med School. And this has got to stop. Because if we lose LSU Med School, we lose the economic engine up in this area.
Mr. Gregg, do you think that this deal will, in the long run, make University Health and make the med school here stronger than they've ever been?
Well, I'm only can deal with today, tomorrow, not 10 or 15 years from now. I hope that they work together, but some things got to change. Let me give you an example. University Health got to start paying their bills. Like the elevator. They have 10 elevators up there, and only 3 of them working. The pacemaker, they owe the pacemaker man. They owe the garbage people. They got to start paying their bill. They owe LSU Med School. Regardless, they might be arguing how much they owe, but we know they owe LSU Med School the minimum of $10 million. The med school cannot exist unless they're paid. And these problems got to stop because you cannot deliver good health care services if you don't have supplies, if you don't have up-to-date equipment. And right now they have a lot of antiquated equipment, and at the same time, people still waiting up there 6 and 7 hours on a doctor and being there for a long time. So we got to do better than that.
And pardon me, Gregg, you have previously blamed biomedical research for those problems, right?
Well, let me tell you, if you don't pay your bills, the only person you can blame is yourself. Biomedical research did not pay their bills. When you have a credit rating of 3 or 4 or 5, no one is actually going to give you that type of credit. When people deliver supplies, COD, and you don't have the check ready and they take the supplies back, that's not delivering good health care services.
Cedric, does this...
About the people, I'm concerned about the delivery services to the needy people.
Does this address that? Does this deal address those things?
Well, but it should, if it goes forward as it should be. Right now, the state of Louisiana owes BRF $70+ million. BRF owes the state of Louisiana and others about $30 million. Now, if we hold your $70 million, it makes it very difficult for you to be able to pay your $30 million. And that's part of what has been at play in the entirety of this situation. What's got to happen from my perspective is that the folks at the Capitol, the folks with LSU, have simply got to do better by Shreveport, Monroe, and North Louisiana in order to be able to not only allow the medical school to survive. The objective is not for it to survive, it's for it to thrive. It should be a vibrant, growing, big part of the North Louisiana economy that has the potential to create jobs, opportunity, entrepreneurs, and elevate the level of wealth in this region. If all we're going to do is be able to just kind of trickle along while New Orleans and Baton Rouge continues to get the lion's share of the opportunity and resources in this state, then we're not going to be able to grow and elevate this community. I'll give you an example. I've always paralleled what's happening at the LSU Medical School to what's happening at LSU Shreveport. 4 years ago, there were 4,000 undergraduate students at LSU Shreveport down on Uri Drive. Today, fall of 2016, there's 2,500. That's a 1,500 loss of students in the last 4 years that nobody's talked about yet at this point. But those are the types of things that are happening to the institutions of North Louisiana because the folks in Baton Rouge, the folks in New Orleans end up prioritizing their needs over ours. As I related to you guys last time we talked about this, you look at the level of funding that has been committed in 2015 to the LSU hospital in New Orleans. $411 million from the state compared to $153 million for the state for university health. That's not right. It's not fair.
Senator Tarver, those numbers, it seems like they're getting more of their share. Do you agree?
Well, let me say this to you. That's not completely true. I think that you need to really look at the budget. I think he's distorting the whole budget. Let me say this to you. One of the reasons why New Orleans get more money than Shreveport because it's much, much larger than the hospital in Shreveport. That's number one.
Well, we have more beds in our hospital, though.
No. Let me say this to you. They have more people who have needs in that area, or low-income people. They have a lot more of them. That's the reason why they get the money, because they perform the type of services that they get the money, number one. Number two, they have contractual services down in New Orleans that they do not have in Shreveport. Now they do have contractual services in Shreveport. Yes, they do. When you look at those items, when you look at last year, Shreveport pulled down 80% of their money by $260 million in October last year, and they failed to pay their bills out of that $280 million that they received at one time. That is the big problem. They're not able to monthly adjust their bills. Why? Because they're spending money on advertisement. For example, $2 million that they spend on advertising. Why would you have to spend on $2 million on advertising for LSU Hospital when people understand and know where it is? You cannot get people from out in Spring Lake to come to LSU. You will have to get the people that is always been serving. Let me give you another example. 75% of the people that go to LSU, the University of Health, are minorities. Now, when you look at that and you look at the employment, the top high-level hierarchy, you see they are not minorities. The reason why a lot of these people do not really get the necessary service is because the people up there do not perform the type of services on these individuals like they should.
Let me respond to that, though. Now, the one thing that is absolutely true is that the LSU Shreveport Hospital has always been able to attract a substantial number of private pay patients. Virginia Sheehy, Aaron Selber, so many, Senator Tarver, and others. But now here's what they've also done. Prior to BRF taking over management, they averaged about $15 million per month in private pay, insurance companies and what have you. That number is now $30 million per month. So they've actually doubled the amount of private pay that's actually coming in to the University Health System. But now let's compare Shreveport to New Orleans. 461 beds in Shreveport, 253 beds in New Orleans. 108,000 patient days in Shreveport, 64,000 in New Orleans. Total discharges in Shreveport, 20,435, 10,870 in New Orleans. Medicaid days in Shreveport, 44,000, 24,000 in New Orleans. State supplemental funds for New Orleans, $411 million, $997,000. Shreveport proposed supplemental funds, $153 million.
Mr.
Tell me
Gregg?
how that's fair.
Well, let me say that it still distorted the figures. Let me tell you something. Number one, when they said private pay, it's not insurance all the private pay. Medicare is private pay. That is how they classify private pay at LSU Med School here in Shreveport, at University of Health. It's not insurance. It's not insurance. It's Medicare, not Medicaid. Medicare. They look at Medicaid care as private pay, and they use these monies to pay the lease on the buildings and everything.
Mr. Gregg, pardon me. We're down to the last couple of minutes. Do you think that this deal is going to get the shadow, all those threats that have been over our shoulders for so long, is sort of going to get rid of those for a while?
Well, let me say this to you. LSU Med School is here to stay, like I said before. No one will try to take LSU Med School. No one will get LSU Med School. LSU Med School is in cement in Shreveport, Louisiana.
I know y'all want to, before we wrap, because we're going to get hit by a hard break. Your message, Representative Glover, to the employees, the folks at University Health and the med school this morning.
Thank you for performing in a way and a manner over these last 3 years that made it impossible for Governor John Bel Edwards, that made it impossible for the folks who are on the other side of this issue to be able to ignore the work, the quality, the performance that you guys have done. And it put us in a position to be able to stand our ground and to make sure that we got this done in a way that is fair to you all as the employees, so that you would be able to more effectively and better serve the people of North Louisiana. Thank you very much, and God bless each and every one of you.
Senator Tarver, our last minute, your message to the folks at University Health and the med school.
The people is doing a good job, an excellent job at the hospital. It's not the people that are working at the hospital that's the problem. It's the hierarchy, the higher administration of the hospital is the problem. But the people have been a superb job. I know because I go there. Cedric Glover don't go to the University Hospital. I go there all the time for different type of tests and everything. And was in the hospital there about a year and a half ago. Stayed 3 or 4 days. What I'm saying to you is they're doing a super job. The employees are doing a super job there. And I hope they continue, but I'm only concerned about the administration, not the employees, because the employees are superb.
Senator, thank you very much. We appreciate your time. Almost a half hour. Couldn't have done it without you. Thank you.
Bye.
Thank you, Senator. Thank you so much, Cedric Glover. We appreciate you joining us.
Thank you, guys, and certainly look forward to being able to monitor this issue as we go forward to ensure that what has been promised actually ends up being delivered.